all fibroids don't need treatment. Hi, I am Dr. Anuradha Panda, Senior Obstetrician Gynaecologist, Laparoscopic and Robotic Surgeon at Apollo Hospital, Jubilee Hills, Hyderabad. Today I will give you an overview about fibroids. Fibroids are very common tumours in a reproductive woman. Around 40% of women may have fibroids, and these are muscular tumours arising from the uterus. And it depends, and they are all non-cancerous, benign, non-cancerous tumours. You shouldn't think any fibroid there may be cancerous or anything. They are benign tumours and very common. And it depends how many fibroids you have. It depends on the size, the number and the location of the fibroids. And your symptoms may be there, you may not have any symptoms depending on the number and the location of the fibroids. So basically we tell it may be on the surface, that is a subserosal fibroid, it may be in the wall, it is intramural fibroid, or in the cavity, which is a submucous fibroid. So usually the submucous fibroid will give you more symptoms, but when it is in the wall it may also give you symptoms, but when it's outside, it's a subserosal fibroids, usually it doesn't give you symptoms. Sometimes you may just feel a mass. So what are the symptoms with which you may present if you have a fibroid? You may be asymptomatic, no symptoms at all. Just you have done an ultrasound for some reason and you find a fibroid, then you come running to the doctor. So you should think that all fibroids doesn't need treatment straight away. So if you have lower abdominal pain or very heavy bleeding, lower abdominal pressure, those are the symptoms of fibroids which are big or inside the intrauterine or in the submucosal cavity. Some people may present with infertility depending on the location of the fibroid, if the cavity or somewhere in the walls. And all fibroids don't give infertility at all. Many people don't even know they have fibroid and they have so many children. So per se fibroid may not cause infertility unless it depends on the location or the size of the fibroid. So your doctor will tell you about that. And sometimes you may feel a big mass in the uterus, abdomen is growing big, and that could be a fibroid growing there. So coming to the diagnosis, ultrasound is the most common method where you do it even for some other thing and you diagnose a fibroid. And other thing which when we think of operating or thinking about the symptoms, or we think about a pregnancy or something, we may ask for a MRI, which will tell us about the location and differentiate for other condition which may look like fibroid, like adenomyosis. And treatment, if somebody has heavy bleeding or pain, we usually start with giving them NSAIDs or tranexamic acid. They will reduce the pain and even the bleeding. But in case the medical, or sometimes we do give them injections, we give them birth control pills to reduce the symptoms of the fibroid if they're small or they're just causing bleeding and pain. But sometimes the medical treatment may not work, or there are some locations where medical treatment may not affect, the bleeding may still go on, that the doctor will let you know and will tell you, will explain depending on the location, and then you may need surgery. So there are two types of surgery, like you may, depending on your age and your symptoms and the number of fibroids, you may go for removal of the fibroid. That's called a myomectomy. Or there's a condition sometimes if the woman doesn't need childbearing, there are multiple fibroid, big fibroid, they may opt for using removing the uterus. That is called hysterectomy. So we can do this either by the normal cutting method, the laparotomies, or we do it nowadays with all modern gadgets. We can do it as laparoscopy, laparoscopic myomectomy, laparoscopic hysterectomy, or a robotic myomectomy or hysterectomy, which is far superior with more precision and better suturing of the myoma bed. So, or there's some condition where the fibroid may be inside the uterine cavity. What is submucosal fibroid? We may use a hysteroscope where we go into the uterus, see where it is there, how big it is, and then we may need to resect it from inside the cavity. So those are the methods of treating the myomas. But to sum up, I would always say that just because you have a fibroid seen on ultrasound, you need not panic. All myofibroids will not need treatment. There are some where we give medical treatment, and there are some people who will need surgery for the myoma. And fibroid per se doesn't cause infertility, and if you are operated for a fibroid, as a myomectomy is done, you can still conceive. It shouldn't be a myth like a myoma, the myomectomy is done, the uterus is scarred. You can still conceive after removing a myoma. Thank you.